11, we're learning how a group of volunteers exactly 50 years ago shaped medical care and emergency services for the city of Virginia Beach. As Alex Littlehales reports, the care we see today grew from the courageous efforts of a few who wanted to make a difference decades ago.
When hospital care couldn't wait, 24 volunteers in Virginia Beach stepped up to make a change.
Because by the time they get to the hospital, if there's no intervention, the chance of their survival is minimal. If we could intervene sooner with some of these cardiac patients, then we could institute some life-saving measures.
1973 saw the graduation of the first ever class of the Emergency Coronary Care Program. Licensed technicians who were cleared to respond to heart-related calls for help in the field, instead of waiting for patients to arrive at the hospital.
Something like 150 citizens in Virginia Beach back in the 70s were dying each year.
Dr. Andrew Dickinson founded the program half a century ago. It's still believed to be the first system in the country that allowed volunteers to administer this kind of medical care. A big shift that helped turn medical transportation into mobile medical care.
We had to go to Richmond, pass a law called the Good Samaritan Law, which would allow volunteers to administer this kind of treatment, which only healthcare professionals were allowed to do.
All volunteers to be able to intervene with advanced equipment and give electric shocks and give medications and start IVs, and that had never been done anywhere else in the country before. The beginning, and you need to have a foundation to build on.
Fast forward to today, the ECCP system is credited with being the foundation of modern-day emergency medical services for the city of Virginia Beach. There are only a few remaining graduates from that original class in 1973. Among them, Jane Brumley, the only woman in the class.
I was the first woman cardiac tech in the state of Virginia. I was the only woman in the first class, so I knew I was unique in that way, but otherwise, no, I just thought I could do the same thing a man could do.
Jane Brumley, John Dickens, Floyd Waterfield, and John Perry. Those four were honored by the city of Virginia Beach for their heroism 50 years ago and the impact they left us today.
They were able to prove that, yes, the technicians can do this, have made differences in patients' lives, too.
In Virginia Beach, Alex Littlehales for 13 News Now.
EMS officials found cardiac arrest calls have steadily gone up since 2017.